Talk Alley here. Today we're going to have another family table talk discussion with my PV edition, my great and wonderful friend, Dr. Dubem. Today we're
Nice
going
to
to be
be on here. Thank you for
discussing,
having me.
yes, so today we're going to be discussing his journey through to residency. He's going to give us all his tips and advice. And right now, Dr. Dubem, could you give a brief introduction?
Yes, my name is Dubem Onyejegbu. I am originally from Nigeria, born and raised. I went to medical school at Texas Tech University Health Science Center, and I'm currently a resident at Baylor University Medical Center, Dallas.
But where did you go to undergrad?
I went undergrad at PV, PV A&M, you know.
You know. All right.
Yeah.
So my first question to you today is what did you do during medical school, both throughout basic sciences and clinical rotations?
Yes. So during medical school, I would say it was first, I think the first year was all about finding balance in between like just trying to be social and also getting a lot of work done and a lot of studying done. I would say for me, I kind of prioritize, of course, whenever I would like get home, our lectures were mostly online or whatever. So I would mostly try and like do most of the stuff, like go around grocery shopping, do things I have to do in the morning, and then watch lectures are like around 12 when all the recordings are already done and kind of knock those out before like 3 o'clock. And then start my own individual studying all the way up until 6 or 7. And then take care of any like assignments or whatever that were given during the day, doing it from like 7 to 8 or 9. And then usually spend the rest of that time just watching movies, or if I had to go out, take care of that then, or hang out with friends, or anything like kind of that's pretty much how my days would go. And always try to get a good amount of sleep before the next day. I would say at least that helped me for the first 2 preclinical years. That was doable. But then when I got to be in the third year, everything kind of changed. And then it's like you have clinicals from 8 to 5, or sometimes 6 to 5, or even earlier sometimes, depending on your rotation. And then you come back and you have to study. And that was a great deal of balancing, along with being a member of SNMA and trying to, work out activities, be there for events and everything. So it was very, very, I was like, it was very difficult towards the end, balancing everything. But at first, my preclinical years, being involved with SNMA, being involved with this barbers. We usually will go around the neighborhood, the community in Lubbock, Texas, and talk to barbers and all this other shops and everything about managing hypertension, managing their blood pressures, just going around and just raising awareness about that, especially in the underserved community. So, because that was something I was passionate about. So just having time to balance those out and also doing activities that brought you to medical school is always a good thing to have in place, because sometimes you can just come in and get overwhelmed with the amount of information they're going to give you. And it's exactly as everyone says, straight from a fire hose, and no one cuts it off ever. But yeah, that's kind of a long conclusion of saying, like, just stick to what brought you in there, continue to have a schedule, adapt, and just be organized as much as you can.
Great. So we have a radiologist on the line. How did you get to radiology? How did you choose it?
I'll be honest. At first, I didn't think I was going to be a radiologist. I came into medical school thinking I was going to be a surgeon. Wasn't sure what type of surgery I wanted to go into, but I just know I like procedures. Going through medical school, I then changed as towards the second year. I was like, oh, I did my cardiology block, and I was like, oh my gosh, I love cardiology. So I was interested in going into like interventional cardiology, or again, just my love of procedures, or going into some CT surgery, which was a very bad idea at the time. I don't know what I was thinking about that. But I would say cardiology was on the top of my criteria in terms of what I wanted to go into as a second year. And then I feel like when I got to being a third year medical student and actually being on the wards and seeing how things went, I would say my love for cardiology kind of started waning down, just because, don't get me wrong, I love learning about cardiology, but the hours, my gosh, That was a no for me because one thing about me I learned about myself in clinical was that um I am a fan of just having a good work life balance lifestyle. I want to be able to go to work. I don't want to be able to have time with my friends and family afterwards. And I feel like cardiology would not offer me that because I'll have to be in the hospital for a long period of time managing patients. So you never know what comes in through the door, and everything can go from a STEMI to just a regular old angina. So you never know what can come through the door. And it's yeah, I feel like that lifestyle really just pushed me away from cardiology. So when I became a third year and I got to experience this interesting case with a radiologist, where the radiologist finding actually part in our course of care, um, it was then finding out that on imaging there was subcutaneous air, which was not seen by our previous eyes, and the radiologist spotted that. That changed our whole goals of care for that patient, and I've just seen
Mm-hmm.
the importance of having a radiologist on the team. So I got more interested. I got to spend more time with the radiologist. It was really good vibes down in the reading room. I really love learning on a daily basis about so many different broad topics. So my passion for learning never stopped. And procedures. You do a lot of procedures in radiology. I didn't even imagine you would, but
Mm-hmm.
I became interested in interventional radiology, which is my passion now, and just how much it brings so much joy to patients and how minimally invasive it is. So that's where my strengths align towards to. And then I applied for radiology fourth year, and here we are.
Okay, so you applied. How did you build your application?
Yes. As I said, I know I was late in the game joining radiology, like it's late third year towards my end, beginning of my fourth year. But I would say for radiology wise, I don't think it really mattered in terms of like whenever you did decide to do radiology. The only other thing you just had to do was have a lot more clinical experience and background. So I went ahead and shadowed as much as I could, got interested, got to get to be in the reading room as much as I could, to see cases, um, and just being active is what I would say, because my school at least didn't have a formal radiology program. So it was harder for me to get more exposure, but I did my best, of course, to advocate for myself and go to the nearby radiologists, and they were also super helpful. I feel like being in medical school gives you the opportunity that you want to have as an undergrad to be able to get exposure to these kind of things. And also building my application was, as I said, a lot more shadowing, just the general application in terms of applying to a lot of different places because things got virtual. So I think on average, I applied to about 65 schools. And then like I applied to like 10 or 15 prelim spots, just because that's how like the radio, I didn't know about the whole prelim stuff before I got to applying. But as a radiologist, you have to do 1 year of prelim in internal medicine, or you could do it in surgery, and then go for 4 years of radiology, diagnostic or interventional. Um, yes, and I applied to 65 regular diagnostic and interventional programs, and I also applied to 10 prelim programs. And I obviously started looking into prelim programs because the interviews do come in a little bit earlier or sometimes later. But you never want to be just rushing to apply to prelim programs because they fill in really fast. I would say another thing too to booster your application is, of course, submit your ERAS on time. Right before everything's ready, you need to have all your letters in ready. I would say it doesn't really matter if you can get from a lot more radiologists, but I try to get at least one radiologist to write me a letter. But they also want to see your clinical attendings writing you letters because they care a lot about internal medicine, I would say. Is because you're going to have to do a medicine year, so that looks good. I think the other two letters, I got one from a vascular surgeon because I was interested in surgery before I got into radiology. And also, I got one from one of my family medicine doctors who knew me really well from when I first started medical school. So it just matters about the quality of the letters and not just necessarily the bulk. I shot for 4 letters just because I felt like you need 3, but you never know. You can kind of like tailor your letters to who you want to send them to, is what I would say. So that's a good
Okay.
strategy I learned. Yeah, but that's mostly the application process.
Okay. And so we know, well, I know about step one. I have no idea about step two. What can you tell us about the difference between the two?
Um,
Like
I would
preparation
say
wise,
step
content
one.
wise?
Mhm. Okay. I would say step one involved a lot of preparation, just because there's a lot of like preclinical stuff, just basic knowledge stuff, and basic science too. I would say it involves a lot more heavy reading,
Mhm.
and it was more different compared to step two preparation. For step one, I did UWorld. I did all the things you would think of and everything to prepare for step one, finish for first aid or whatever, everything, all that. Anki cards, the works. Um, Step two preparation. I would say I only prepared for like 5 weeks. And it was like more of like just getting through UWorld was what I would recommend. We were some very good resources for step two, and going through the Emma Holiday videos, going through all the stuff you studied during your clinicals from like say the whole of third year, just because it's very relevant. I would say step two is a lot more relevant. It's like things you would see, even if you're not sure in terms of content wise, if you saw this or not, you can able to reason through it because it makes sense. Obviously, step two made a lot more sense than step one. Because step one was just a bunch of random information that you're not sure if you knew or don't know. But step two is more of like a clinical scenario, and it makes you think a lot more proactively. So I would say you will definitely the M Holiday videos, definitely Divine Intervention. That Divine's videos were really good to prepare for step two. And just going over all the stuff, your notes from the year and stuff if you have time, or I feel like step two was makes a lot more sense, and especially to plan your clinical rotations in a way where you finish your family medicine. Um, that helps a lot because family medicine is pretty much bringing everything together like step two. And internal medicine to me is like 40% of step two. So if you do really well in your internal medicine, you collaborate everything together towards the end of all your third year rotations in family medicine, you should be more than ready to take step two in like 4 to 5 weeks.
That sounds great. All right. And lastly, Dr. Dubem, any
Mhm.
additional advice you have to students in general and to younger Dubem?
The only advice I would say is just to have a really good work ethic and have a plan. I would say for me going into medical school, my plan was always to do the best I can do in college, get all my prereqs done, make sure there's nothing holding me back from getting in, and of course applying with your best foot. Even if you have to take the MCAT a little bit later or a little bit earlier, it depends on how ready you are. And I would say never like rush into things just because people around you are doing it. We're all running individual races. I feel like for me, I always do my own things at my own time. I made sure that I was ready and I was mentally prepared. If not, I wouldn't take it. And I would say just know how of a good test taker you are too. So you can work on those skills and start preparing early. I feel like preparing early for a lot of stuff in life will get you to places you need to be. Just with the medical school residency, whatever you want to put your mind to, just do that. Another thing I'll remember, at least telling myself, was it's gonna get very rough. It's gonna get very hard. A lot of people are gonna test you. It's gonna be patience. It's gonna be clinical work. A lot of things will happen along the way, but don't lose the things that brought you to where you are. Keep family close. Keep if it's like your religion, just keep praying. Depends on, like just do everything you've been doing before they got you here because they're gonna keep you sane and keep you very well healthy mentally too. So yeah, that's what I would say.
That's amazing advice. Thank you for your time, and we'll catch you guys next time.
It was a pleasure having me. Thank you so much.